This is a short review of some minutes for labor and commerce in the U.S. in Nevada, as Las Vegas Institute was obviously dealing with some concerns about its dentists that were flying in without licenses. So if we refer to the minutes, the opening discusses who was present, and that would include a professor from Alberta, Canada, Norman R. Thomas, who was given the role of Director of Neuromuscular Research. We can scroll down, and there's discussions about the 9,000 dental professionals from around the world visit LVI each year. So that would be possible repeat dentists from the year prior. Many were taking multiple courses, so likely not completely new dentists every year, but anyway, a substantial number considering if there's concerns with information being taught, and also possible procedures done without liability coverage. And again, we can scroll down and find different representatives making a pitch for their hands-on seminars. It says the program has superior dentists. It's good for the economy of Las Vegas. Let's see here. Here's reference to Dr. Norman R. Thomas, DDS, Director of Neuromuscular Research, Las Vegas Institute for Advanced Dental Studies, Las Vegas, Nevada. So his commentary included, I am Professor Emeritus from Canadian University, which is accredited by the American Dental Association. We abide by the rules of the ADA with respect to continuing education. I have degrees in dentistry from the University of Virginia, Medical College of Virginia, the University of Alberta, and with honors from the University of Bristol in the United Kingdom. I'm very familiar with education around the world, particularly in terms of continuing education. I was Professor Emeritus at the University of Alberta when I found that there was an institute in Las Vegas under direction of Dr. Dickerson, which was a remarkable and unique feature of continuing education. It contained not only the applicable parts of dentistry, but also founded upon sound science, the neuromuscular process, which was developed by Sir Charles Sherrington, who received a Nobel Prize for his work. There is no institute comparable with the Las Vegas Institute. Even though I worked as a professor for practically 50 years, I have a doctorate and fellowship from the Royal College. I'm certified as a specialist in oral pathology and oral medicine. I was thrilled to have the opportunity to come to Las Vegas and be part of the facility of LVI Global. I'm now the Director of Neuromuscular Research, which is being instituted into dental schools, but not with the same level of expertise as found in LVI Global. I am pleased to be here to support this bill. I think it is a tremendous opportunity for dentistry. Canada is responsible for 20% of the students attending LVI Global. I'm now an ambassador for evidence-based dentistry of the ADA. Now, I couldn't find reference to his position as evidence-based advocate, and it's kind of a conflict that he would be promoting neuromuscular dentistry that is a questionable science and claiming it has anything to do with evidence-based dentistry. And for them to be promoting it to dentists across the world is quite a responsibility. So now that the approach of neuromuscular dentistry is being questioned, everyone associated with it is also under scrutiny. So we have to consider this ties the University of Alberta in Edmonton, Canada, with this program in Las Vegas, and the relationship with the Promoting Dental Lab in Calgary, Alberta, and its relationship with the Alberta Dental Association and college. So we have multiple relationships, including this professor was working while the Dean of Dentistry, Dr. Gord Thompson, was there, and he also moved into the position of Executive Director at the Alberta Dental Association College. So we have all these weird associateships that link people, and probably slightly embarrassing to be considering that neuromuscular dentistry now is banned in Ontario and Manitoba, Canada, representing almost half the dentists in Canada working in jurisdiction where this approach is not recognized. And also many legal experts across the U.S. are calling out this approach as being associated with overtreatment and treatment that is no better than a placebo in its success rates. So if there's high cost of this approach, the dentist is rewarded financially, but the patient ends up suffering in the end. So let's look at this a little bit deeper another time.